When I first started on this whole hypermobility journey, I truly thought it wasn't worth getting a diagnosis because I'm a physical therapist. Physical therapy can help reduce your pain and your symptoms. So what would be the point of having these words on my diagnosis chart at the doctor? And it wasn't until I started having all of these comorbid conditions that frequently go along with it that I realized how having this diagnosis has made my appointments with specialists so much more straightforward, because it guides their treatment and guides their thought process to be like, oh, connective tissue, this is probably what you have. I do think there are a lot of reasons, there are pros and cons to get a diagnosis. So let's get into it. The first con to getting a diagnosis and seeking that out is that it's not accessible, specifically in the US. For many reasons, financial being one. Even if you have insurance, you have to pay thousands of dollars. It's just, rent is hard enough to afford these days. Adding that onto it is just truly not attainable for many people. Even if you have health insurance that covers a lot, insurance can decide that they don't want you to see a specific provider. They want you to see who they want you to see, even though that person may be super biased, not advocating for you, not willing to learn. And there are just so many unknowns with knowing with what provider you're going to be with. It's not accessible. And if that is your reality, I'm doing the best I can to add free resources to help you learn about your body. I think the number one thing that is important, whether you seek out a diagnosis or not, is understanding your own body so that you can best advocate for yourself. For me specifically, that's been the thing that's helped the most. Number two, it takes a long time to get a diagnosis. Years, a lot of times, at least in the US. Your primary care can help with a lot, but if you get referred to specialists, connective tissue affects every system in the body. So a lot of people have to see a specialist for every part of the body. And then it takes months to even get into the specialist, add in follow-ups, lab testing, imaging, anything that you need in between. It can take years. Not everyone is able to dedicate that much time to it. Then, on top of that, taking off work in order to go to these appointments. It's just not attainable. Now, the reason it may not be worth getting a diagnosis and seeking that official one out is, what is it going to change for you? Just something you got to reflect on yourself to decide if it's worth it. I originally thought it wasn't worth it for me. There is something to be said for validation, and that's worth it if that's what your goal is. But there's also borderline. There's hypermobile spectrum disorder that a lot of people just don't know about. And other than a referral to physical therapy and to some specialists, is this diagnosis going to change something for you? And I think for a lot of people it will, and I think for some people it may not. So that's where you just have to figure out, is it worth it to seek out a diagnosis for you? Because everyone is different. All right, let's get into the pros of why you should get a diagnosis. Number one, why you should seek out a diagnosis. There are a whole lot of comorbidities that go along with hypermobility. Yes, there's the part that everyone sees, oh, I'm flexible. there's a lot more going on inside than you may realize. The people that are my patients, where we start talking about it, will sometimes even throw some of these things around as a joke. I'm like, I think everything you've dealt with probably was related to this. And some of these people are like at least in their 50s, if not older. I had one guy and he was like, yeah, like how my brain can't even like stay focused. And I was like, yeah, probably. And because connective tissue is throughout your entire body. I'm going to make a separate video on specialists that I recommend you seeing, because that'll be a whole video in and of itself. But there's a lot, and there's a lot of body parts that can be affected. And for me personally, having the diagnosis and then going to a specialist, for example, my neurologist, I said, hey, I'm having headaches every time I stand. I also have Ehlers-Danlos syndrome. To kind of help her put it together, she said, oh, well, because you have a connective tissue disorder, you may have a spontaneous cerebrospinal fluid spinal leak. I feel that as if she did not know that information about me. I mean, why would you suspect a spontaneous leak in someone who can still stand up and mostly exercise, unless you add too many of those postural changes or too much exertion or pressure on my joints? At least me, I wouldn't have connected those dots. So that's just like, yeah, one personal example. Same with like cardiologist. I have this condition and they ended up finding super borderline, but mitral valve prolapse, which a lot of times isn't symptomatic, but is part of the criteria for hypermobile Ehlers-Danlos syndrome. My cat is very active right now. But yes, I personally think that it helps your specialist appointments to kind of helps them tie all the pieces together to find the best treatment plan for you. Number 2, it can help your family members and just help with like future research on this condition to build awareness. I have so many people, a lot of times it's a teenager that like comes in starting to have some pain, treating them. And then usually they're young enough that like their parent might be, or they at least drove them, or they may be in the room with them. And I'd be like, oh, you're pretty mobile, and kind of do some screening questions. And a lot of times the parent is the one, I look at them and ask them questions and they're like, oh yeah, like we all do that. We all have that. I'm like, it's genetic. And people don't realize until their kid gets diagnosed that they have it. And the more diagnoses that exist can help further future research. Right now, EDS is still considered rare, and I truly don't think it's rare. I think it's misunderstood, and there are a lot of people walking around undiagnosed because they've been told that they're flexible, and that's a good thing. Yay. So yes, for the sake of future research, for the sake of your children or other humans around you going through the same thing, I think having that will help further medicine and the medical fields to be able to learn more about the condition and do research on you. Maybe participating in research studies would be another way you can do that. And number 3, validation. There's a lot to be said for validation and truly having the peace to know that all of your symptoms are explained. I tell my patients a lot. I know they usually come in saying that, oh, there's so much wrong with me. And what I tell them is, there's one thing. I know you feel like you're falling apart, but it's one thing. It's connective tissue, and that affects everything. And sometimes if we can figure out the one thing, it can guide treatment for the rest of them. If we don't have that, it can make it hard to find a treatment plan and work with them. So this is why it may be worth getting a diagnosis or it may not for you. I'm going to post a lot more about the topic. It is my number one topic or question and comment that I get. I would love to hear from you in the comments. 1, are you diagnosed? 2, are you seeking a diagnosis? And what was your journey like? Was it worth it for you? Or maybe it wasn't. And figuring out, just hearing other people's stories, I think will be helpful. So yeah, comment below. And then stay tuned for my next video, which will be the top 3, might be 3, the top providers, specialists that you should see if you're hypermobile, to make sure we're looking at the whole body. Other thing is, if you are looking for a healthcare provider and you want to start this process, you can go to the Hypermobile Ehlers-Danlos syndrome website. They have a health professionals directory. You can search your area and see if there's anyone close to you that is familiar with the disorder or hypermobility in general. Thanks for watching, and I'll see you in the next video.